Hi everyone, my name is Wendy, and in this video we're going to talk about opioid medications. And I have three classes, and those include opioid agonist, opioid antagonist, and opioid agonist antagonist. And those are three different classes, and don't get them confused. I will explain them further as we get on with the video. Okay, so we are going to discuss the mechanism of action, the use for the drugs, the nursing assessment, the adverse effects, and patient education. Also, I'm going to discuss some fun mnemonics to help you memorize the medications. Alright, we will start off with the opioid agonist. And the mechanism of action for those is that they bind to opioid receptors in the central and peripheral nervous system, activating the G protein coupled signaling pathways that inhibit pain transmission and alter neurotransmitter release. So, in short words, they basically block pain receptors, specifically the opioid receptors. And these are used for relief of severe, acute, or chronic pain, preoperative medication, analgesia during anesthesia. So, for some common medications for these drug classes is tramadol, methadone, fentanyl, morphine, and oxycodone. And I have a fun mnemonic to help you memorize those as I put them in an order. So my mnemonic is take my full morphine opioid. And the first letter of each word represents the letter of each medication. Okay, so for the nursing assessment, prior to giving the medication, you want to check the respiratory rate, and you'd have to hold the medication if the respiratory rate is less than 12 respirations per minute. Also, you want to check for the pain level, and you also want to check for the level of consciousness. And then after giving the medication, you want to reassess the pain level to make sure the medication actually helped the patient. And you want to check the respiratory rates once again, and this will make more sense when I explain the side effects. And you want to check the oxygen saturation. So for some adverse effects, this medication can cause respiratory depression, which makes more sense why you want to assess the respiratory rate before and after giving the medication. And you want to check for sedation, as this medication can cause CNS depression as well. And you want to check for constipation, and this is common to most of the medications. And then for some education, you want to check for the risk for dependence and want to avoid taking any other sedatives while on this medication. And lastly, you want to change position slowly, as this can cause orthostatic hypotension. Okay, now I'm going to talk about opioid antagonist. And the mechanism of action for those is that they block opioid receptors and reverse the effect of opioids. So they basically do the opposite of what opioid agonists do. And this one is used for respiratory depression, sedation, and for treatment of opioid overdose. And some common medications for that is naloxone and naltrexone. And I'm pretty sure most people are familiar with naloxone. It's also known as Narcan, and it's used for overdose reversal effect. And the fun mnemonic I have for this medication is NAL, which is the beginning of both medications. And this sentence says NAL has two pads, aux and trax. So NAL is the beginning for both medications, and aux is for one of the medication, and trax is for the second medication. Okay, so for the nursing assessment prior to giving these medications, you want to assess the respiratory rate, and typically it has to be at least 8 respirations per minute, because this medication blocks the opioid receptors, so that means they do the opposite of what opioids would do, and that means it will help raise your respirations just enough to stay within the normal range. And you want to assess for the level of consciousness. And some nursing assessment after giving the medication, you want to reassess the level of consciousness for the therapeutic effect, and you want to reassess the respiratory rate. Make sure it's high enough but not too high. And then you want to monitor for opioid withdrawal signs. And then for some adverse effects, this medication can cause opioid withdrawals, which can be a little rough. It can also cause hypertension and dysrhythmias again. And then for some education, naloxone will usually last about 30 to 90 minutes in the system, and you still want to seek medical attention. And also the withdrawal symptoms, which I already mentioned. And then you want to teach family members and friends how to give these medications. And lastly, I'm going to discuss the opioid agonist antagonist medications. And the mechanism of action for these medications is that they activate the kappa receptors, which relieve pain, and they also block mu receptors, which block some agonist receptors. So these medications, they do both agonist and antagonist, but they kind of balance themselves out to make sure they block just enough of the other and just enough of the other one to give you a therapeutic effect. So the use for this medication is to treat moderate to severe pain that requires opioid medication. And some common meds for these medications, there's only 3 of them, and these include buprenorphine and butorphanol, and lastly nalbuphine. And these ones are a little tricky to pronounce, but it's okay. So I have a good mnemonic for that one as well, and that is Bubuna, the AA crew. I like to call them the AA crew because, it's agonist, antagonist, so they both start with A, and that's the easy way you can memorize it. So for the nursing assessment prior to giving these AA crews, you want to assess the pain level, you want to assess the respiratory rate, and you want to assess for the cardiac disease. So this one can be a little rough to the heart, and you want to make sure that people with cardiac diseases, they do not take this medication. And then nursing assessment after giving the medication, you want to reassess the pain, and you want to monitor the respiratory rate, and you also want to monitor for withdrawal symptoms, which are similar to the other ones I mentioned. And this just can be a little rough for people that use opioid medications. And then some adverse effects, once again, withdrawal symptoms and sedation, dizziness, and avoid in patients with known cardiac diseases. And then for some education, you want to know that if you're dependent to opioid medications, these can cause heavy withdrawal symptoms, which I mentioned, like tremors, sweating, tachycardia, palpitations, those kind of things. And then avoid alcohol and other sedatives when you're using this medication. And lastly, pain relief may not be as strong as opioid agonist. And this brings me to the end of this video. I hope this video was very helpful, and I hope the mnemonics that I came up with are also helpful with memorizing the medication. And thanks for watching.